Today is World Heart Day, and it's a reminder to everyone around the world to take care of their hearts. This year's campaign focuses on the essential step of knowing one's heart with the aim of increasing awareness of cardiovascular diseases and how to control them. The International Day was established by the World Heart Foundation in collaboration with the World Health Organization. Let's get more perspectives now on the World Heart Day. I'm joined on the news by a consultant cardiologist at the Lagos State University Teaching Hospital, Kasma Amadi. Dr. Amadi, thank you for joining us on the news this hour. Help us in clear terms, the way everyone can understand. The heart isn't something you can see, so to speak. Usually we just touch our chest to feel the heartbeat. How do you take care of your heart?
Well, thank you for having me. The heart is perhaps the most important organ in the body. With due respect, every organ of the body is very important. But the heart is the seat of it all, the center of the universe, as it were, for the body. Now, the heart does a lot of functions, principally to move blood around the body through a pumping mechanism. So you can't see your heart by opening your heart because the person will die. So it's a surgical procedure by which we carefully open the chest and look at the heart. But nobody does that. The essence of today is to draw awareness on the importance of cardiovascular diseases around the world and to encourage people to pay attention to what can lead to heart disease. The reason is that cardiovascular diseases are the #1 cause of death every year all over the world. So you can imagine one group of diseases causing more death than any other group of diseases put together. So it's an important public health issue. Most importantly, cardiovascular diseases are largely preventable. We have over 90 reasons why people should have heart disease. And that means those 90 reasons are potentially addressable through rigorous and intentional lifestyle adjustments. And of course, medications where need be. So by extension, the whole idea of World Heart Day is to introduce people to the concept of cardiovascular, health care, where the individual takes care of their heart by living
Dr.
intentional
Amadi,
right.
I was hoping that you could just help us break it down and help us understand the lifestyle, the activities, perhaps even what we eat or what we do that can help us, take good care of the heart. Just the simple daily activities that you will recommend for Nigerians, to Nigerians.
Okay, fine. That's pretty very easy. Now, sedentary living, that's physical inactivity, is the #1 contributor to cardiovascular disease. So if we're looking at preventing cardiovascular disease, we will encourage people to be physically active. What do I mean by that? At least 150 minutes of brisk walk per week. The more the number of hours or minutes you do, the better it is for cardiovascular health. Then moderate consumption of food. Some foods are very energy laden. The carbs, the high protein diets, the fatty foods. This can affect cardiovascular health. So we encourage people to be very, very moderate and very, very considerate in their intake of foods. To eat in moderation, watch their portion sizes so they don't get big. When they get big, it has overworked, and this could lead to cardiovascular disease. We also ask people to watch their salt intake. Too much of salt, in this case, too much of sodium, increases blood pressure. Blood pressure is a cardiovascular disease risk factor that can harm the heart and cause a cardiovascular disease. We also ask people not to smoke. Smoking is a no-no. There's no single benefit, with respect to smoking. So we encourage people not to smoke, and for those who smoke, make intentional efforts to quit smoking. Alcohol is neither here nor there. We don't want anybody to take alcohol in the first place. But if somebody must take it, must be in very, very strict moderation so that we don't overburden the heart with alcohol. And of course, careful and responsible and safe management of psychosocial stress. These are all behavioral, issues that tend to increase heart disease all over the world, especially in a place like Nigeria.
Exercise, take away smoking and drinking. That may be very, very hard for some to do. But are there symptoms to look out for, where cardiovascular diseases are concerned?
Yes, there's some classical cardiovascular disease symptoms like chest pain. Unexplained chest pain, has to be sorted out. So anybody has a chest pain, they can't really explain the cause of, should see a doctor to rule out a cardiovascular disease. There's what we call is angina, which leads to heart attack and sudden death. So it comes with chest pain. So someone has chest pain that, is not resolved with simple analgesia or analgesic like paracetamol, should endeavor to see a doctor who will take time to look at the, natural history of that chest pain and whether it's cardiovascular in origin or not. Palpitations, which is awareness of heartbeat, is not so a cardiovascular disease symptom. When people have their hearts, pound, and when people are unduly aware of their heartbeat, it's not a good thing. So it's good for the doctor to check it out to be sure it's not arrhythmia, which is another cardiovascular disease entity that can lead to cardiovascular problem. And shortness of breath, unexplained shortness of breath, shortness of breath out of tune with exercise. It's also another cardiovascular disease symptom which needs to be evaluated and properly looked at.
Indeed.
So these are the cardinal symptoms.
I'm afraid that's our time. Consultant cardiologist at the Lagos University Teaching Hospital, Dr. Kasma Ahmadi, thank you so much for talking to us on the news tonight.
Thank you very much, Jen. Thank you.